we are losing a lot of women to cervical cancer, and thus the need for creating awareness. So cervical cancer is an abnormal growth of cells in the cervix. You can see the cervix up there in the diagram. It's actually the lower part of the uterus that connects to the vagina. So cervical cancer is normally caused by the human papilloma virus or the HPV virus. So this virus is normally passed on through sexual contact. For some individuals, the virus may not cause any harm and it may go away on its own. But for some, it may cause changes in the cells of the cervix, leading to cervical cancer. So we normally have several types of the human papilloma virus, but type 16 and type 18 normally pose the greatest risk. Cervical cancer is the fourth most common type of cancer in women worldwide, but the good news is that it is the most preventable and treatable type of cancer once it has been detected early enough. So what are the risk factors to acquiring cervical cancer? One of them is having multiple sexual partners, or having a partner who has multiple sexual partners. So this would put you at a risk of acquiring the human papilloma virus. Something else is smoking. So if you normally smoke, you're at a more increased risk of developing cervical cancer. Starting sexual activity at an early age would also put you at a risk of developing cervical cancer. And then having a weak immune system, which could be due to conditions like HIV, AIDS, maybe diabetes. This would also put you at a risk of developing cervical cancer. If your immunity is strong, once your body has been exposed to the virus, the body will fight off the virus and also prevent the virus from causing any harm. So having a weak immune system would actually put you at a risk of developing cervical cancer. Something else is acquiring sexually transmitted infections frequently. So what are the signs and the symptoms of cervical cancer? So during the early stages, cervical cancer does not normally present with any signs and symptoms. You'll be able to go about your daily activities normally. But then after the cervical cancer has progressed, you may experience signs and symptoms like bleeding after sexual intercourse. We have intramenstrual bleeding, or bleeding in between your menses. And for someone who is already in their menopause, they may start again bleeding. Something else is painful intercourse. And then you also have lower abdominal pain. We also have lower backache. One may have a vaginal discharge, which could be bloody, heavy, and could also be foul smelling. So management of cervical cancer depends on the stage in which one is in. So in case you experience such signs and symptoms, go to the hospital. Have yourself screened. Actually, there are other conditions that may have some signs and symptoms that are similar to those of cervical cancer. So until you go to the hospital, your doctor may not be able to make the right diagnosis. So there are several or various investigations that will be carried out. For example, biopsy, whereby the doctor will get a sample from the growth in the cervix, and the sample will be taken to the laboratory, and from there the doctor will be able to make a diagnosis. The other investigations like the CT scan, you have the MRI. So after the investigations and the physical examination, actually physical examination would entail a vaginal examination, we have speculum examination, and then so a combination of the physical examination and laboratory investigations, as well as other investigations, will be able to, or will help the doctor make the right diagnosis, and also do staging of the cervical cancer. So management of the cervical cancer, like we've said, will depend on the staging. We have 4 stages. We have stage 1, whereby the cancer is only localized to the cervix. We have stage 2, whereby the cancer will have started spreading to part of the uterus and part of the vagina. We have stage 3, whereby the cancer will have spread to the pelvic wall, the abdomen, and you have stage 4, which is the final stage, whereby the cancer will have spread or metastasized to other body organs, for example, the lungs. So what can we do to prevent acquiring or to reduce the risks of acquiring cervical cancer? So one of them is get vaccinated with the human papilloma vaccine or the HPV vaccine. The vaccine is normally given to girls with, at the age bracket of 9 to 14 years. This is because it's assumed that it's at this age that girls will start being sexually active. However, it doesn't mean that other individuals or women who are older than that age bracket, or ladies who are older than that age bracket, cannot receive the vaccine. Only that girls in that age bracket are the ones that are normally given the priority. So this vaccine is normally available in most public and private hospitals. So make sure that you get vaccinated. Something else is avoid smoking, practice safe sex. This is by using protection and also by avoiding having multiple sexual partners. And in case you acquire any sexually transmitted infection, make sure that you are treated promptly and in time. Make sure that you have routine pap smears. It is during these pap smears that the cancer would be detected, and if it's detected at an early age, it will be treated more easily, and progress or prognosis or the healing will take place faster and more easily. So something else is make sure that you live a healthy lifestyle by eating plenty of fruits, plenty of vegetables, greens, drinking a lot of water, exercising. All these will help build your immunity, and this will reduce the chances of acquiring cervical cancer. Thank you very much for your time. I hope the video was informative. Don't forget to kindly subscribe, to like, and to share this video, and let's create awareness so that we reduce losing our mothers, our grandmothers, our aunties, our sisters, our cousins. Yeah, thank you very much, and bye bye.